Have you ever wondered how something invisible can shut down an entire city? Or why something as simple as hand washing can literally save lives? Hi everyone, my name is Grace Riley and I am currently a pre-nursing student at Franciscan University. Today I'll be discussing the ins and outs of infectious diseases, their signs and symptoms, spreading factors, real-life examples, and how the monitoring of infectious diseases has changed over time. As you can see on this slide, I have created a roadmap of what information will be covered throughout this presentation, from definitions and characteristics to signs and symptoms to monitoring and tracking. Throughout this presentation, we're going to be dissecting it all. In order to understand how an infectious disease spreads, we must first understand what it is. A disease can be categorized in two different ways, an infectious disease or a non-infectious disease. Firstly, an infectious disease are diseases that are due to pathogens. Secondly, a non-infectious disease are diseases that are due to genetics and the environment around. Today, I'll be focusing on infectious diseases. An infectious disease is a disease caused by the invasion and growth of pathogenic microorganisms within a host. These hosts can be humans or even animals. Examples of these pathogenic microorganisms are viruses, fungi, bacteria, or even parasites. Today, I'll be focusing on infectious diseases. Signs and symptoms are two categories of characteristics that can be present when an individual becomes infected by a disease. On one hand, you have signs. They are objective and can be measured. Common signs include fever, chills, sweats, change in cough or a new cough, and sore throat. Contrary to this, you have symptoms. Symptoms are subjective and are specific to each individual patient. Common symptoms include fever, coughing, shortness of breath, muscle aches, fatigue, and sore throat. Moving on to what causes infectious diseases, as well as these signs and symptoms to be present, I'll be discussing pathogens. A pathogen is an organism that causes a disease in a host cell or tissue. Types of pathogens. First off, there's primary pathogens. This is a microorganism that can cause disease in a healthy individual. Secondly, opportunistic pathogens. This is a type of pathogen that normally does not cause disease in a healthy host with a functioning immune system. They can only cause disease when a break compromises an individual's protective barrier. As stated previously, infectious diseases are due to pathogens that invade a host cell. There are many different ways to catch an infectious disease, but they all begin with exposure. On this slide, I have listed the steps for how a pathogen causes disease. First, exposure, then adhesion, next, invasion, fourthly, infection, and finally, transmission. Moving on to infection categories. Again, infectious diseases are due to pathogens that invade and cause disease in a host. Different infectious diseases cause different symptoms, which place them into different categories. Infection categories include local, focal, and systemic. A local infection is a condition which originates and remains confined to one part of the body. A focal infection is a localized infection, often asymptomatic, that causes disease in other parts of the host and can spread. A systemic infection is a disease that affects the entire body, rather than just a single organ or one part of the body. These systemic infections can impact multiple body systems or organs simultaneously. An infection will be classified as one of these three, considering the extent that the pathogen spreads. Continuing in my discussion of pathogens, I'll be discussing their portals of entry and exit. Firstly, a portal of entry is where the pathogen can enter or gain access to the body. All except one are exposed to the external environment. Examples include eyes, nose, mouth, vagina, needle, broken skin, urethra, insect bite, and placenta. The placenta is the only one not exposed to the external environment. Similarly, A portal of exit is how pathogens leave the body and go on to infect a new host. Examples of portal exits include eyes, mammary glands, placenta, vagina, skin flakes or broken skin, urethra, nose, ear, needle, insect bite, and anus. Moving on to virulence factors. Virulence is the severity of a disease which contributes to pathogens' ability to cause a disease. This includes things such as adhesions, endotoxins, exoenzymes, exotoxins, capsules, and antigenic variation or shift. Specific virulence factors include an endotoxin. This is the lipid A component of a gram-negative cell envelope. Next, an exotoxin. Proteins secreted mainly by gram-positive bacteria but are also secreted by certain gram-negative bacteria. Next, capsules. Pathogens evade a host by producing capsules to avoid phagocytosis. Fourth, antigenic drift or shift. These are viruses such as influenza that use this to avoid being recognized by the immune system. As we continue to discuss infectious diseases, there are some important terms to know and understand first. Beginning with epidemiology. This is the study of how diseases and health conditions are spread and how they affect an area or population. Next is morbidity. This is being in a state of illness. Then you have mortality. This refers to death, specifically death tolls or rates in relation to a certain disease. Then you have prevalence. This refers to the total number that is affected in a certain area or population. Moving on to sporadic. Sporadic diseases are ones that occur rarely without a geographic focus. Then you have endemic. Endemics are diseases that occur at a constant level and are prevalent in a population or certain areas at all times. Then you have epidemic. Epidemics are diseases that occur suddenly in excess of normal expectancy. Finally, you have pandemic. Pandemics are an epidemic that is widely spread throughout a specific area, such as a country, and can even be globally. Next, I'll be discussing how diseases have been tracked in the past and are now being tracked today. Disease tracking, also known as disease surveillance, is an ongoing process of collecting, analyzing, and disseminating health data to monitor and control the spread of diseases. In early times, epidemiologists such as John Snow would study diseases based on their population level, and they would use this data to interrupt and stop the spread. Today, tracking diseases has become more technologically based. Diseases are currently being tracked by some of the following techniques. Firstly, social media monitoring. This involves analyzing social media posts for mentions of symptoms, disease names, or related keywords to detect potential outbreaks. Next is the use of digital disease surveillance. This involves using artificial intelligence and algorithms to analyze large data sets from various sources, including health records, social media, and environmental monitoring. Then, the use of geospatial analysis is now being used. This involves mapping disease cases and correlating them with geographic locations to identify potential hotspots or certain patterns. Finally, their use of real-time data involves utilizing data streams from emergency rooms, pharmacies, and other sources to detect and respond to outbreaks quickly. Moving on, I'll be discussing how diseases spread. There are many different ways diseases can spread. I'll be discussing a few. First off, reservoirs. Reservoirs include all things such as humans and animals' populations, soil, water, and inanimate objects such as toys. Next, there is contact transmission. This can either be direct or indirect. Contact transmission happens through physical contact with either an infected host or contact with a fomite that an infected host has made contact with in the past. Thirdly, vector transmission. This happens when a living organism carries an infectious agent on its own body to a new host. Fourthly, vehicle transmission. This happens when a substance like soil, water, or air carries an infected agent to another new host. Specifically, vehicle transmission, which was mentioned on the previous slide, happens when a substance like soil, water, or air carries an infectious agent to another new host. Vehicle transmission can happen in a few different ways. Firstly, through droplet contact. This can happen through exhaling, coughing, or sneezing. Secondly, through airborne transmission, which is the spread of pathogens via aerosol into the respiratory system of a new host. This must spread farther than 1 meter. Thirdly, through fecal-oral transmission. This is through waterborne pathogens, which is shed in feces and subsequently ingested. Lastly, through healthcare-associated infection, also referred to as HAI. This can be contracted in a hospital, doctor's office setting, or clinic. Next, I'll be discussing real-world examples of infectious diseases. The first example is a common cold. This is a viral infection of the upper respiratory tract. Secondly, hepatitis B and C. These are a viral infection that affects the liver. Thirdly, influenza. This is a disease that is spread through airborne droplets. Fourthly, COVID-19, also referred to as coronavirus. This is a contagious disease that causes symptoms in the respiratory tract. Continuing in my discussion of COVID-19, this infectious disease was a pandemic that started in 2020 and affected people across the globe. It is a contagious disease that causes symptoms similar to a cold or flu. Symptoms of the virus include fever, chills, sore throat, fatigue, cough, stuffy or runny nose, brain fog, shortness of breath, change in sense of smell or taste, headaches and body aches, diarrhea, nausea, or vomiting. COVID-19 is spread by breathing out droplets which contain small particles of the virus. This is an example of droplet contact. The spread has now slowed down due to a vaccine that was created as well as other precautions taken such as social distancing and wearing a mask. In conclusion, infectious diseases are caused by pathogens, a microorganism that can have a wide range of signs and symptoms. Pathogens invade the body through specific portals of entry and exit, using virulence factors to cause illness and evade the immune system. Disease transmission can occur through contact, objects, vehicles, and healthcare settings, making hygiene and prevention critical. Real-world examples, such as COVID-19, highlight the global impact of infectious diseases and the importance of public health measures. Awareness, early detection, and preventative practices like hand washing, vaccinations, and surveillance are essential to controlling the spread of infectious diseases. I have also put together a list of a few questions to ask yourself after viewing this presentation. These are my references I used for my information throughout my presentation. This concludes my presentation. I hope you were able to gain some knowledge on infectious diseases, how they invade individuals, how they spread, and what we can do to stop the spread. Thank you for watching.